Hi students, welcome to HSC Biology in Module 8, Non-infectious disease and disorders. This is the last video, number 25, and we're going to talk a little bit about the efficacy of medical technology. Specifically, we're going to ask you to evaluate the effectiveness of technology that's used to manage and assist with the effects of a disorder. Now, hopefully this is something that you've been doing along the way when you've looked at some of the technologies that we've associated with improving hearing, improving vision, and also with dialysis for kidney dysfunction, that each of those technologies has been, I guess as you've analysed each of those, you've been working through processes of analysis of their effectiveness. But we're going to look at something, just one very quick case study and a very hopefully useful overview for you to ask yourself some questions when you're looking at any of these technologies. This one becomes specific, so you do want to make sure that you've got some examples for each of those areas and that you're able to try and be relatively clinically critical about the technology, how useful it is, what specifically is it designed to manage, what are its advantages and disadvantages, and I guess to be able to pronounce some sort of a value judgment on how effective that particular technology that you're looking at is. So let's do this in two steps. Let's first of all go through our little checklist of the sorts of things that we might be looking for when we're evaluating technology. So are there any advantages associated with the technology? Hopefully the answer to that's going to be yes, because otherwise why would we use it? So what are some of those advantages of using this particular technology with this particular disease or disorder? Are there any disadvantages? Are there any things that we need to be aware of in terms of some perhaps negative effects associated with the use of these technologies? What are the costs? The costs, of course, are not just financial. They can also be personal. And you'll see that in just a second. What are some of the effects on the individual of using or not using the technology? So what are and I guess this comes back into some of the advantages if we use the technology or disadvantages if we don't use the technology, but they're also personal. What sort of quality of life does the person have without this technology, and what, if any, improvements will they experience with the technology? Are there ongoing challenges or benefits associated with the technology? Are there potential complications? Are there duplications? Are they going to have to redo processes, or is it a one-time fix everything situation? What are some of those ongoing challenges? How available is the technology? What's the access like? Is it available to all people in all places at all times, or is it limited in some way? How well does the technology function compared to normal human function, and what's the longevity of this technology? Now, obviously, this is going to differ when you're going through a specific technology, depending on whether you're talking about something that's maybe an installation, like a cochlear implant, or whether it's a process like dialysis that you can kind of see in the back of this slide here. And so if we, because we most recently looked at dialysis, so let's just quickly go back to this process of dialysis, which you can see in front of you, a patient who is having a hemodialysis process. All of the blood is coming out of the body, going through the dialysis machine, coming back into the body. And so you can see that this is basically an external filtration process. So what are some of the advantages? Well, the advantages, first of all, is obviously that this patient is not effective at filtering their own blood. So that's going to lead to a buildup of wastes. It can also lead to fluid imbalances. Obviously, they're not going to be in the same they're not going to have the same ability to regulate their water levels, salt levels, and so on. So a disadvantage with the technology is time. We mentioned in previous slides that the problem associated with dialysis is that it can take a very long period of time for all of the blood to move out of the body through the dialysis machine and back in again. And so it means people are attached to this technology for quite some time. And obviously that is going to have an effect on the individual if you've got to come in on a regular basis, several times a week, connect yourself up to this machine and have your blood filtered in this way. Any other disadvantages with the technology? that you can think of should also be listed here, and I can think of some things associated with, say, laser surgery for eyes, with the maintenance of things like contact lenses for eyes, with battery life, for example, for hearing aids. So remember to expand your thinking about this evaluation of technology to all of these different technologies that you've looked at. Good to prepare one in detail, but I'm not going to guide you into which one that should be. I think it's important that you select one that you're comfortable with, that you know enough about, that you could write a nice, well-constructed response for an HSC question. Dialysis we've talked about in terms of the effect on the individual a little bit, both if they are able to have this external filter to their blood and what happens if they don't have it. Some of the ongoing challenges and benefits associated with this. Obviously there is a benefit associated with being able to have the blood filtered on a regular basis, but the challenge is having to continue to take yourself into a place. Usually this sort of technology is not necessarily something that can be done in the home, so it often has to be, patients have to go in order for this procedure to be carried out. And that means that there's no universal access to the technology. Whilst there's a number of different dialysis machines around, and certainly different hospitals and a number of medical centres may have access to these sorts of technologies, they may not be universal, and certainly they may not have an endless supply of them either. We know that there's some challenges too associated with the technology. I didn't talk in the last video about blood thinners, but obviously there has to be particular things added to the blood. If you're going to have it flowing outside of your body for long periods of time, we don't want it clotting. We want it continually moving smoothly and cleanly through all of these tubes, through the dialysis itself. And so we want to make sure that that blood's not going to clot. So we have to add some additional things to it. We know that this is basically, it's a two-way system, but it's primarily trying to work one way, trying to pull some of those important substances out of the blood. So if you think about the function of the nephron, it's at the glomerulus where all of that material is pushed through the membranes into the Bowman's capsule, and then after that we do that reabsorption thing. We look at waters, we look at salts, we look at glucose, we reabsorb them from the tubes back into the blood system. Well, this is a little more tricky in the sense that what we're trying to do primarily is to remove some of those key waste products from the blood, get them to move across the semi-permeable membranes, and to keep replenishing that supply of dialysate, that's basically the fluid that's flowing around the outside of the membrane, with the blood flowing in through it as well. And then you can also talk about longevity of the technology. How often do we need to replace these things? You can see a lot of the components associated with dialysis are plastics, but with any medical technologies there's also a high turnover in terms of maintenance of hygiene and clinical conditions. So therefore not a lot of things can be reused. Some things can be washed, other things need to be thrown out and replaced. And so there's a range of different factors that we want you to consider when you're looking at evaluating a technology that's associated with hearing disorders, vision disorders, or disorders of the kidneys. That's it. That's the end of the Module 8, and it's also the end of the HSC course. Good luck with your HSC exams. I know this has been a very challenging year. We're in 2021, the second year of COVID, and there's been a lot of students who've been doing a lot of work remotely. And that's created a huge challenge, but hopefully it's also helped you to be focused on what it is that you need. Hopefully some of these videos have been a little bit helpful to you, and all the very best for your upcoming exams. Thanks for watching.